Alright, good morning. I'm going to do an ABG. So the first thing I need to do is check the patient's chart for the doctor's orders, and then I need to check to see what the patient has for medications, if they've had any history of needing to be held longer on the artery so that way they don't bleed out. So the first thing I'm going to do is I'm going to knock on the door, I'm going to wash my hands, I'm going to introduce myself and check the patient's ID band, and then I'm going to also assess a patient before I begin and position them to where I need them to be. And so first off, I'm going to extract the patient. I'm going to have either a towel or tissue paper, something to go underneath their arm. So I'm going to have them extend their arm and have something underneath to help me, so that way it kind of brings up everything to be able to get that ABG. And then I would tell the patient about what I am doing. So this is an ABG, arterial blood gas. This is just to see the oxygen in the blood levels and everything, and to see what your levels look like. And this is going to be taken from the artery, so it's a little different than other blood draws that you have done, and it's going to be a little more sharp pinch than you're used to. And if they're uncomfortable with the blood draw, I can have somebody help me hold their arm steady, just in case if they start shaking or anything like that. So before I take the blood draw, I always need to do a modified Allen's test. So I would include, but first I'd apply my PPE before I do any blood draw, anything like that, because you don't want any blood on you, just in case if you have any open wounds or anything. So then you would occlude the ulnar and radial artery, and so you would have them do a fist 3 times while occluding them, and then when they open up the 3rd time, you would release the ulnar artery, and then you would watch to see how many seconds it takes for the flushing of the skin to come back. Now if it's a negative flush, then I would check the other arm. You always want to do the non-dominant arm when you do an ABG. That way it isn't so uncomfortable for the patient or anything. And so when it comes back and you're good to go and you have a good blood flow and you feel that your radial pulse is pretty good and it has a strong pulse, then we're ready to go and get started. So we would take our alcohol prep wipe and we would wipe it down the area where we're going to take the blood draw, just to make sure we don't pass anything. And so then we would throw that away and dispose of it. And then we would prepare our needle, make sure it's on the proper thing where we need to be to get the appropriate amount for the lab. When we're ready, and then we would remove the cap of the needle, and then we would position in our hand at a 45-degree angle like we're holding a pen or pencil, and then you'd have the bevel facing up, that way you don't puncture anything else but the artery. So when I'm ready, then I would palpate the pulse again, and when I'm ready, I position myself to where I can get it, and then I would remove my finger so I'm not in the way. And then you should be able to begin to see blood flow through here if you hit it properly. And then when you are done, you would take this and you hold it there. Try not to poke yourself when you're removing it. Hold down on the site. Then you take the needle and you put it through the stopper and dispose of it. But since we don't have not going to dispose of it, we will put the cap on here. And then we would remove the needle, make sure the needle's off, and then we would take clean gauze or anything and remove any air bubbles if there's anything like that, or clots. And we'd place a cap on, place it into our biohazard bag, and then we would place a label on it. So the label would have the patient's name, their temperature, the date that I did the test, and then I'd have to put what kind of test that I took, and I would put an ABG. And then the ventilation would be like if they're on room air, so you would put the FiO2 of 21%. So then you would place that on the bag, and this would need to take immediately to the lab. And if you can't get it to the lab immediately, then you need to put it on ice until you can get it there. So then when we are done with that, we always need to make sure they are done bleeding, and if they are on anticoagulants, you would hold it more than 10 minutes, but you would place on a Band-Aid on the wound site and tell them to leave it on there for at least 4 hours, that way to prevent any infections or anything to go wrong with the patient. And so when we were done, we would clean up everything, make sure we disposed of the needle, anything that had blood on it, sanitize everything, clean it up, and then I would remove the PPE and I dispose of those, and then I would reassess the patient and always wash my hands before I leave the room or when I'm done doing an ABG. And then I would chart everything on the patient's chart after the blood has been taken to the lab, and then I would let anybody, like the nurses and the doctor, know that I got that blood draw done.